Thank you for tuning into our best practice series for medical providers working with refugee and immigrant youth and families. This is one video in a larger series hosted by the Trauma and Community Resilience Center at Boston Children's Hospital. Each short video will highlight experts in the fields of medicine and psychology who work with refugee and immigrant youth and families. We are grateful to SAMHSA and the National Child Traumatic Stress Network for their support in making this series happen. In this video, we'll be hearing from Dr. Shannon O'Malley and Dr. Frances Cheng. Shannon O'Malley, MD, is an assistant professor of clinical pediatrics in the section of hospital medicine, the deputy director of the Yale New Haven Children's Hospital's clinical pathway program, and an inpatient medical director at Yale New Haven Children's Hospital. Her non-clinical interests are advocacy and public policy, health education, and community-based participatory research, particularly with the local refugee and immigrant community. She serves on the executive board of Academic Pediatric Association's Public Policy and Advocacy Committee and is a faculty co-advisor for the Yale Health Education and Literacy for Asylees and Refugees, or Y-HEALAR program. And she was a co-founder of the Yale Peds Residency longitudinal advocacy curriculum. Frances Cheng is an assistant professor of clinical pediatrics in the section of hospital medicine at Yale School of Medicine as well. She co-founded and now serves as a faculty co-advisor for Y-HEALAR, an academic community partnership providing health education classes for the refugee community in New Haven. And she is a co-chair for the AAP Section on Hospital Medicine's Subcommittee on Global Health. Her academic interests are in global health, refugee and immigrant health, and neonatal opioid withdrawal syndrome. Frances and Shannon are currently working together with several refugee-serving community organizations on a PCORI-funded project aimed at strengthening research capacity within the refugee community in New Haven, Connecticut. And now I'll pass it to Shannon and Frances.
Thank you so much for that introduction, Dr. Butala. We are honored to be here, and today we'll be talking about the care of refugee and immigrant children in the newborn nursery. While many of the principles we'll cover have also been discussed in depth during our webinar, Care of the Hospitalized Refugee and Immigrant Child, this session will specifically address their unique needs in the hospital setting. So birth and early infancy are significant and sensitive times for families and often are accompanied by specific cultural traditions and beliefs. And as pediatricians, the newborn nursery is one of the few moments when we care for both the infant and the birthing parent as our patients. So this highlights the importance of practicing cultural humility, which is a lifelong dynamic process that goes beyond cultural competence. It means staying open, curious, reflective, and honoring the family's lived experiences and expertise. So we'll walk through 5 key principles for providing cultural humble care in the newborn nursery. So the first is knowing your community and recognizing immigrant families. So we can start by learning about the largest immigrant populations in our area and their cultural traditions. Some of the tools that are helpful are these resources where we have provided QR codes to link to them. One is newcomer profiles, and another is resources on peripartum and infant care among refugee groups. And these can help to learn more about the cultural practices of the most populous groups in your area. Next is building respectful, trusting relationships and taking time to validate families' experiences and honoring their cultural beliefs. So since our time in the nursery with them is very short, often just a few days, it's important to collaborate and consider collaborating with our OB and our nursing colleagues to ensure continuity of care. Next is collaborating with community partners and engaging local community leaders and organizations who might understand these families' unique needs. And these insights can help to enhance care and help ensure that it's meaningful and respectful based on their experiences. Next is supporting and adapting our care to align with cultural values and preferences. This can include tailoring our discharge instructions and educational materials to align with the family's language and cultural values, and includes using interpreters, translated materials, and culturally concordant visuals whenever possible as well. And next is advocating for structural change and promoting policies that can address the social drivers of health and support initiatives that are led by the communities themselves. And this can include working with community health workers and supporting local advocacy efforts. So by embracing cultural humility in the nursery, we can provide better care and build trust, improve outcomes, and support families during one of these most sensitive times in their lives.
Though not a comprehensive list, we will discuss some evidence-based approaches now for communication with families involving interpretation and translation. And first, we'll start with interpretation. So use interpreters whenever possible in the newborn nursery. Make sure you use short, clear phrases and express this to families at the beginning of the encounter, speaking directly to the mother or birthing parent or parents in the room is also very helpful. And generally, children should never be used as interpreters. Additionally, we just want to say at this time that it's important to be mindful of interpreter use overall in this sensitive setting, and that with some cultures, they may not want a male provider, or to be mindful of offering either in person, over the phone, over an iPad, and whether the family should have the option to not be seen is also very important. Translation is another thing that should be considered, and considering health literacy overall for the families. So using things like visual aid or calendars can be very helpful. Offering as well to have the family record or use voicemails while you're using your discharge instructions can be helpful, and making sure that they are language concordant and culturally concordant as much as possible. And on the next slide, we just wanted to give an example of a visual aid that we use in our hospital or in the outpatient setting as well. So creating culturally concordant images and instructions can be very helpful, and using specifically community ambassadors or community members to help create those can be most impactful. Overall, for our conclusion, we just want to emphasize that cultural humility at this time especially is very important because there are so many different cultures, and all of these cultures have very unique cultural practices during the birthing, postpartum, and newborn time. So educating yourself as much as possible and using resources in your area can be very helpful. Again, being mindful of interpreter use during this sensitive time, and specifically with male interpreters and male providers. And finally, providing discharge instructions and discharge and videos in the family's language is very important. So thank you for listening to this brief webinar. Here is our contact information and a QR code with a list of resources. And thank you for us allowing to be part of this best practice webinar series.
Thank you to Dr. Cheng and Dr. O'Malley for sharing your expertise with us, and thank you to all of you for watching. If you're interested in learning more, visit our YouTube channel for more videos. The link is in the video description.